Greetings. Welcome to today's webinar titled Affordable Care Act, Managing Compliance with SubFinder Relief. During the webinar, we will provide an overview of the Affordable Care Act, review how the mandate will affect you, explore how SubFinder Elite can help, and finally equip you with the resources to learn more. I want to start off with a disclaimer. Because we are not your legal counsel or tax and accounting experts, we can only speak to how SubFinder can help your organization manage compliance with the ACA mandate. If you have questions specifically about the mandate, requirements, or how your organization should prepare, we suggest that you refer back to your experts, such as your attorney, benefits administrator, and/or accountant. So what is the Affordable Care Act? It is a piece of legislation that was signed into law on March 23, 2010. The law mandates that every individual is required to obtain adequate health care coverage for them and their dependents, or they will be forced to pay a penalty. Any employer with at least 50 full-time employees or full-time equivalents in the preceding calendar year will be designated as a large employer and will be required to provide health care coverage. If you fail to comply, you will face a penalty as well. For most employers, it is set to take effect on January 1st, 2015. The Affordable Care Act will affect employers differently depending on the size of the company. Small companies which have less than 50 employees are not required to provide coverage and do not have to complete ACA forms. Large companies, those with 50 to 99 employees that aren't currently providing insurance to their full-time workers, are required to report on their workers and the current coverage in 2015. Employers in this category have until 2016 before any employer responsibility payments would apply. Larger companies, those with 100 or more employees, need to offer coverage. They have the ability to phase in the percentage of full-time workers. In 2015, they need to be at 70%, and in 2016 and beyond, they need to be at 95%. Employers in this category that do not meet these standards will make an employer responsibility payment for 2015. What constitutes a full-time employee? The Affordable Care Act states that any employee who works 30 hours or more a week or 130 hours or more a month during the organization's defined look-back period is considered full-time. What is a look-back period? The look-back period is used as a measurement of time for determining if an employee is full-time. You establish the length of the look-back period and stability periods. The stability period is the period of time in which health care benefits must be provided to qualifying employees. The duration of your look-back period is between 3 and 12 months. This is established by you. The stability period must be greater than or equal to the look-back period, but a minimum of 6 months and no greater than 12 months. For example, let's say you have a measurement period of 3 months. During the 3 months, you will be determining which of your employees are averaging 30 hours per week or 130 hours per month. Once you establish which employees fall within those qualifications, you will be required to provide them with coverage or face a penalty. How is the ACA going to affect education? Since not all employees report a full 12-month period, there has been some question regarding how to handle calculating their average hours for the summer months. An educational organization employer cannot take into account the likelihood of an employment break period when determining its expectations of a new employee's future hours of service. An employee who works full-time during the active portions of the academic year will be treated as a full-time employee. This applies to all employees within your organization, including substitute teachers. So how can SubFinder Elite help you manage ACA compliance? There are two ways that we can help. In SubFinder Elite, you have the ability to limit the number of hours that a substitute is allowed to work during each week. Any substitute who has reached the limit will be unable to accept and view additional jobs, ensuring that no substitute ever works over your defined weekly hours limit. In addition to limiting the number of hours per week for substitutes, you can run the Substitute Weekly Hours Report to manage your substitute's weekly hours worked. This report, which is available in Excel, provides you with the list of substitutes that have worked during the defined period as well as the number of hours worked each week. Let's take a closer look into these options within SubFinder Elite. Within SubFinder Elite, there is a setting within the Substitute General Information screen where you can set a max hours per week. This is where you can define the number of hours a substitute can work during a week. This can be used to prevent substitutes from working more than a specified number of hours per week. Only the SubFinder Elite operator or an administrator has the ability to override this value based on an individual substitute basis in the event of a long-term assignment or a last-minute emergency where you need to get a substitute in the classroom. The practice of limiting employee hours as a direct result of the ACA mandate has been a source of great debate over this last year. This practice has become more common in the retail and fast food industries. There is speculation that suddenly limiting employee hours could be construed as an employer discrimination, a potential unemployment matter, or possibly a violation of Section 510 of ERISA. The ERISA is the Employee Retirement Income Security Act, which is a federal law that established rules and regulations to govern employee-provided pensions and other employee benefits provided to U.S. employees. For example, it makes sure that you cannot fire someone at the age of 64 because they are eligible for a pension at 65. Some speculate that the ACA will be added to the section of the ERISA. If you are planning on limiting the number of employees per week for substitutes, we strongly suggest that you consult your organization's legal counsel before configuring the setting to ensure you are protected against any potential legal action. In SubFinder Elite, you can generate the Substitute Weekly Hours Report. This report is available to the system operator and to any administrators who have been given access to create reports. The Substitute Weekly Hours Report includes the ability to pull the report based on a date range and filters of site or site group and job position or job position group. When this report is generated, it includes a listing of all substitutes that have worked during the defined date range along with the number of hours they have worked each week. The report is generated in Excel to allow you to calculate the average hours worked each week for every one of your substitutes. To run this report, access the substitute reports on the SubFinder Elite Reports bar. The title of the report you are looking for is the Substitute Weekly Hours Report. To define your filter criteria, click on the report name. First, establish the date range you would like to run the report for. Then, define your filter criteria. Do you want to run this report for a specific site or site group? Are you pulling it based on a specific job position or job position group? Once you've defined your criteria, click OK. The Substitute Weekly Hours Report will generate in Excel. You can now sort, filter, and calculate the average number of hours worked for each substitute. Note, this report only includes substitutes who have worked during the defined period. If a substitute has not worked, they will not be included on the report. Stay up to date with changes as they become available by visiting CRS's dedicated ACA Resource Center on our main website. Here you can find our FAQs, defined terminology, this webinar, as well as some links to additional sites that have Affordable Care Act information. Please keep checking back for additional information. We have some additional resource links as well. If you are interested in some light reading, healthcare.gov has provided the entire Act broken down into sections. The IRS has provided resources, including a Q&A on shared responsibility provisions and how it affects employers. In addition, they have a section created especially for educational organizations. Do you have questions on SubFinder Elite? Feel free to contact us. We can be reached by telephone, email, or chat. If you have any questions regarding SubFinder Elite and how we can assist with the Affordable Care Act compliance, please contact us. Thank you for your time today.